here.
Iliopsoas.
I don't stick iliopsoas in every patient. It kind of depends on the reason the patient's there. Studying more than one of them, I think, is good. And if you're looking for a radiculopathy, which is the most common reason you would be sticking this muscle, just because radiculopathy is probably the most common reason people are coming to the lab. I think it's okay to stick more than one femoral innervated muscle, just to show that you have some neurogenic change in more than one muscle in those levels. So for this muscle, what I do, so if you read in books, they'll say find the femoral pulse and then go a little bit lateral to that. I don't typically find the femoral pulse when I stick the iliopsoas. It's actually not a very deep muscle. It's pretty superficial. What I do is find the sartorius, which is a lot easier to find. The sartorius is like right here. And then I go, I can't see it.
It's because you see that muscle, you know it's there.
Yeah.
But in obese patients,
Yeah, it's harder. It's harder. It's a lot more blind procedure in obese patients. But it's not a very deep muscle. So I think you're probably not going to nick an artery if you're staying very superficial. So this one,
So where's Sartorius?
it's right here. It kind of goes around like that. Can you lift your whole leg up? Yeah, then you can see it. Kind of pops out. So you're going to go medial to that, and you're going to go just below the inguinal ligament, about a couple finger breadths below the inguinal ligament. And so so the way that I activate this one is what I've seen people do that I don't think works well is you ask the patient to lift the leg off the bed, and I think when you do that you get a lot of motor units, and you can't really tell what's what. So for this one, I just ask the patient to lift the knee off the bed just a little bit. And you're right there. I'm not very deep at all. I'm just barely there. And iliopsoas can be a little bit tricky sometimes. The motor unit potentials in iliopsoas can have a slightly increased number of polyphasic motor unit potentials, and they can also be shorter in duration, lower in amplitude in normal people, and so I think it's really easy to overcall myopathic motor units in the iliopsoas. So just be very careful about that. Although I think it's still useful to study iliopsoas and myopathies because they're often clinically involved.